Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
Welcome to Brilliance Business TV, conversations with leading experts in business. I am your host, Mark Stephen Pooler. We have a wonderful guest coming on the show today, Dr. Alex, and we're talking all about depression, so stay tuned. We are streaming live on Facebook, Twitter, Instagram, LinkedIn, YouTube. We're also on the E360 TV network under Fresh Takes, going out to Apple TV, Fire TV, Android TV, Roku, and many more. We're also on mspnewsglobal.com, and we're also on Business Innovators Radio Network. I want to make an official shout out to our show sponsors, Dreamweaver, Artist Ranch. So let's bring in our incredible guest, Dr. Alex Joannou. Welcome, Dr. Alex.
Good morning, Mark, or good evening, your time.
Yes, good evening, my time. I'm really looking forward to a conversation with you today, Dr. Alex. So firstly, tell us a little bit about yourself.
Well, I've been a GP for 40 years, general practitioner. In fact, this month, October, is the anniversary of my 40th year in general practice. And through that time, I've seen a lot of patients. I think I added up over 300,000 consultations at that time.
That's a lot.
That is a lot. And over the last 25 years, I've also been performing acupuncture, some 35,000 treatments in that time. And I've been training junior doctors, GP registrars as they're called, over the last 20 years. So I'm quite familiar with teaching and what the needs of health professionals are in managing patients, particularly through health problems, mental health problems. In general practice in Australia, I'm sure it's the same in Britain now, is that mental health is the number one problem doctors are seeing.
You've been keeping yourself very busy, Dr. Alex. Like you mentioned, mental health, depression. I think it's so universal. So many people at some point will have these kind of issues, won't they?
Exactly. And over the last 10, 12 years, I've particularly focused on using acupuncture to treat depression and anxiety.
How does Western medicine view depression?
It's a good question. It gets back to the World Health Organization's definition of health generally, which states that health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. That sounds really fantastic, to have complete physical, mental, and social well-being. There are probably not too many people that could say that they are in that state. But the reality is that doctors are trained to look for disease, disorder, and infirmity. Doctors will quiz a patient, ask for symptoms of whatever their problem is. They examine them looking for abnormalities, and then they perform blood tests or imaging and other more invasive tests to determine what's abnormal. So if a doctor doesn't find anything abnormal, by definition, they're normal. And that's where the doctor stops. And this can be a source of frustration for many patients, particularly, for example, chronic fatigue, where a doctor will time and again tell a patient, you're normal, all the tests are normal. In the case of depression, it's even a more difficult situation, because there's no particular blood tests or imaging. Image of the brain won't tell you if you're depressed or not. So the doctor, most of the assessment comes from the doctor asking the patient questions. They'll quiz them about their low mood, lack of concentration, lack of interest in hobbies, fatigue, poor appetite, sleep patterns, food, family history, how their relationships are going and so forth, and what medications they're using, and drugs, illicit recreational drugs as well. And the doctor will look at how a person appears, whether they look sad, look depressed. So if the doctor doesn't find an abnormality, they're normal.
But the thing is as well, Dr. Alex, you can't always tell with depression. Some people mask and put on a great face.
Yes,
so
absolutely.
People who commit suicide, people don't even realise that they're going through mental health or depression, do you?
Yeah, absolutely, totally. And I guess this was actually what sparked me on this path was a friend of the family who committed suicide after a seemingly minor dispute with a neighbour over a fence, literally, and killed himself. And it was just a complete shock. And
I hear you.
To everyone. So I guess that was one of the things that sort of spurred me into looking for a solution to depression.
How is depression diagnosed and measured, Dr. Alex?
Yeah. Well, doctors use nowadays what's called the DSM-5, which stands for the Diagnostic and Statistical Manual, the 5th edition. That's published by the American Psychiatric Association. When I was in medical school, it was about 120 pages in the 2nd edition, and now it's nearly 1,000 pages in the 5th edition. The details, there's a specific checklist, basically, that a doctor will quiz a patient and tick the box. And literally, if a patient fits 5 or more of those ticks over a period of at least 2 weeks, by definition, excluding other factors that by definition they have depression. I detail it more in my book, Stick It to Depression, on page 21, which goes into some detail about that.
Stick It to Depression. I'd encourage everyone to get a copy of this book.
Yes, it's available on my website, also on Amazon. So
At the end, we will go over those details, Dr. Alex. Now, what role does medication play in the treatment of depression? Yeah,
well, first of all, I just like to mention about once the diagnosis is made, is how it's monitored. And it's monitored by a checklist, usually. The commonest one used is the DAS 21. This is a common quiz. And it's literally based on your answer to 7 questions as to whether you're depressed or not. The questions are, I couldn't seem to experience any positive feeling at all. I found it difficult to work up the initiative to do things. I felt I had nothing to look forward to. I felt downhearted and blue. I was unable to become enthusiastic about anything. I felt I wasn't worth much as a person. I felt life was meaningless. So in those 7 questions, you score 0, 1, 2, or 3. And that's depending on whether you don't have the problem in the last couple of weeks. You have it to a mild degree. And then often, if you're having it often or almost always, scores it as 1, 2, and 3. And that adds up to 21. 7 times 3 is the maximum score. But anything over 11 is considered severe depression.
Yes, and I can relate to a few of those as well.
Yeah, and a score of less than 5 is considered normal. You'll notice none of those questions are asking, do you feel happy? When did you last have a good belly laugh? It's all negative stuff. So, as I say, doctors are looking for abnormalities.
Now you've said those questions, you can see how it answers the questions that you're looking to answer as well.
Yeah. So, I mean, even if you score 4 in other words, you've scored, say, 2 on a couple of questions or 3 on one question and 1 on another, you're still considered normal by doctors, even though most people would say, well, that's not a state of complete mental well-being, certainly not social well-being either.
Well, I'm sure to get to a place of scoring 0, that is an ambition.
Yeah. So you asked me about medication.
Yes. The question was what role does medication play in the treatment of depression?
Well, it currently plays a huge role in the treatment of depression. One, because it's so easy to prescribe, it takes a matter of seconds to write a prescription. And we live in a nanosecond world where people want things fixed instantly. So it's easy to look for a pill for an answer. There was an interesting study once a few years ago. I hope the figures have improved, but in that study, they demonstrated that from the moment a patient walked into a room with the psychiatrist, the psychiatrist generally knew within 20 seconds what he was going to prescribe the patient.
Wow.
That's quick. So, and it's very common for people to go into a doctor and ask for medication. If they ask for a medication, especially by name, I think one study showed that they were 17 times more likely to be prescribed the antidepressant than if they don't mention antidepressants.
I hear you. What role, how does the effect of your acupuncture differ from medication in the treatment of depression?
Well, I was just going to say before that, with medications, the medications work. Well, nobody really knows. They talk about serotonin reuptake inhibitors working on serotonin, the so-called happy hormone. But nobody really knows how they work. But they do seem to have an effect of depressing or suppressing, rather, emotions. So if you're feeling really downhearted and blue, that dampens that down so you don't feel as depressed. But by the same token, it seems to dampen down positive emotions as well as the negative emotions. And if you're severely depressed, medications have been definitely proven to help the situation. But in mild and possibly even moderate depression, the effectiveness of antidepressants is very much in question because if you're on antidepressants, it's hard to have a good belly laugh. If you watch something funny on a TV show, and the effect is to blunt those emotions. So you feel less joyful or less happy. And a problem is compounded by the DAS score because, if you're not actually looking to see if somebody's happy or joyful or ecstatic, you're not gonna find it if you don't look for it. So the medications can possibly only bring you up to a state of being normal, bring you to a state of being scoring somewhere between 4 and 0.
I hear you.
So in a sense, being less sad has become the new normal. If you know what I mean.
I hear you. And I suppose if it's a really, really bad depression, you can understand why people would need the medication. But for those that aren't so severe, you don't have to go down that medication route.
Yes. And obviously the other arm of traditional medicine is to refer patients to a psychologist and use things like cognitive behavior therapy. It all takes a lot of effort and time, of course, compared with the speed of taking a pill. That's the allure of medications.
I hear you. Dr. Alex, I'm really enjoying the conversation. We just need to go to a commercial break, so please stay where you are. Thank you, everyone, for joining us for part 1 of Brilliance Business TV. We're in conversation with Dr. Alex, talking all about depression and acupuncture. Stay tuned.
Hello, this is Stephen Buckner, and just wanted to tell you I support the Dreamweaver project. It's a great project where, artists such as myself will be able to come together and basically collaborate and to have a retreat to feel accepted and welcome. And that's something that artists here and around the world could always benefit from. So I just want to say, please support the Dreamweaver project. I think it's for a great cause, and I salute all the independent artists out there and artists that are signed as well. And have a wonderful day.
Welcome back to Brilliance Business TV. We're in
Thanks,
conversation with Dr. Alex, and we're talking all about depression and acupuncture. Now, Dr. Alex, let's talk a little bit about chakras and what role do the chakras play in treating depression?
Yeah. It's an interesting question. The thing is, acupuncture works through, in the traditional Chinese sense, they look at the internal organs, and the organs are connected to various emotional states. For example, with the liver, it's anger. With the heart, it's lack of joy. With the kidneys, it's fear, and so on. And the general concept, understanding is that emotions get stuck in the body. If you've been in a situation for a long time, or it's a strong emotion, it can get stuck, and the acupuncture releases that. And quite often during a treatment, a person will have an emotional release, like suddenly burst into tears over something that happened 30 years ago, or often they can't even connect it to a particular event. The emotion comes up, and just as quick as it comes up, it can go away. And after a treatment, they can have a meltdown. Their husband or wife can say something to them, and whammo, out comes the emotion. So, but the thing is, once it's released, even though it could be a shock to one and all at the time, they feel much better afterwards. The transformational acupuncture that I do works on the chakras. Now, chakras are energy centers based on the Hindu Ayurvedic system. The word chakra really means a vortex of energy. It's where we get our word circle from. So you have 7 chakras, from the root chakra at the base of the spine up through to the crown chakra at the top of the head. Interestingly, and I'm not the first person to pick this, they correspond to Maslow's hierarchy of needs, which has at the bottom, if you recall, pyramid shape, at the bottom it's safety, survival. If you're starving, hungry, it's hard to think and be creative. You feel hungry all the time, and you need to fix that. Similarly, if you've lost your accommodation and you haven't got anywhere to live, that's the total focus of your mind. But once these lower needs are taken care of, then you tend to be able to be in a creative space, and the ultimate is self-actualization and ultimately transcendence, where you are really thinking of the good of mankind and so forth. So the interesting thing is that I've developed a questionnaire which works out where people's chakras are out of balance. And based on how they answer the questions, then I perform acupuncture to work on those points.
I hear you.
It actually works. If person's issues concern safety and survival, and I work on those points to treat that, they often can relax and feel safe. Often the safety is through events that happened a long time ago, and there's no personal need to worry about it now, but the trigger's still there. So by working on that, that helps their depression. I've found over the years that any of these chakras, usually 2 or more, sometimes all of the chakras are out of balance, and then that takes more work to get people back into some sort of balance.
I hear you.
It does have a powerful effect that way. And yeah, this is something that's not taught to acupuncturists, this particular system.
How is your acupuncture you teach different from the generally accepted form of acupuncture?
Yeah, well, generally the acupuncture, whether it's the Chinese form or Japanese or Korean, it's based on the concept of those internal organs associated with emotions when we're dealing with emotional problems. But the acupuncture I teach is based on the chakras, which is something that's not taught. I mean, it seems amazing to me that the Hindu system of the Ayurvedic understanding of chakras and the system of yoga developed in India over the last 3,000 years or so. And in China, which is just a neighboring country, the whole concept of acupuncture points and the channels and connection to internal organs, again, was developed over that sort of time frame. And yet there's been no communication between those two systems in all this time until 1997, actually. The first book was written about the subject.
Got you.
So, what I've developed is to introduce then the Western understanding of depression, and my questionnaire involves a lot of positive type questions as well. That a person says that they feel safe, that they feel happy, and so forth. So, the aim is not to just feel like you're normal, but to get you into a state of complete mental well-being.
I like the sound of that, Dr. Alex.
Yeah.
And what outcomes can our viewers and listeners expect if they have your kind of acupuncture for the treatment of their depression?
Yeah, well, that's a good question. Usually, in most cases, I recommend people having a treatment weekly for the first 8 weeks, and I monitor how they score on these on this questionnaire. So sometimes you'll find a certain chakra is the most out of balance, or there's 2 or 3 of them, and even within a week, that score changes, and different issues might come up. So then I follow down that path and so forth. Usually by the time you've had 8 treatments over 8 weeks, at least 8 out of 10 people feel an improvement. And 3 or 4 of them will feel an amazing improvement in that time frame. Depending on how much they've improved, I usually then recommend a treatment fortnightly or 3 weeks or month, or even every 6 weeks, depending on how easy it is for them to come for a treatment and how much they've improved. Because once your body's shifted, you need just a bit of a treatment every so often to maintain the state you're in. And people are usually very happy to keep coming back because they are feeling actually happy.
I had a friend.
Yeah.
I had a friend who was an alcoholic, and the doctor prescribed him acupuncture to help him as well. Right.
Yes.
Yes. And what would you recommend our listeners do now then, Dr. Alex?
Yeah. Well, anybody who's really interested in this, whether they're patients or relatives of patients, or whether they're doctors themselves or other acupuncturists, if you go to my website, stickittodepression.com, there's a start here button which easily explains itself. You press the button and it filters out who you are and what your needs are, and we'll definitely start there.
So go to Dr. Alex's website, stickittodepression.com. You can always always reach out to Dr. Alex at
Yes.
Dr. Alex at stickittodepression.com. That's Dr. Alex at stickittodepression.com. Also, just pick your book up once more and tell our audience where they can get their copy and what they will get from the book.
If they go to the website, there's links that where they can get that from.
That's stickittodepression.com.
Yes.
Dr. Alex, I thoroughly enjoyed having a conversation with you today. Thank you so much for being my guest.
Thank you, Mark.
The pleasure's been all mine. Thank you, everyone, for watching Brilliance Business TV.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.